Today, we're going to start with our 8 questions in 8-minute episode. And this is a program where we ask speakers and professionals about clinically relevant questions. And those questions will be some added value for clinicians to get some guidance on how they practice. Today, we have with us Dr. Mathew Landry. He is an assistant professor of population health and disease prevention at the University of California. So we're going to start with our first question. In order to be able to break weight loss plateau, or the weight loss plateau dilemma, we need to understand in its multiplicity of physiology and psychology. And these two factors are, I think, interrelated. How do you define it from a clinical perspective? And what is the set point theory that causes the weight loss? What's your take on it?
So what we typically see when people lose weight is that they lose it very quickly in the first few weeks after making those lifestyle changes, maybe lowering their calories or cutting back on carbs. However, after a few weeks or months, the scales come to a complete standstill, or the numbers actually start to creep back up. In research, that often happens around 6 months. And unfortunately, at this stage, people become discouraged. So that's the psychological kind of impact. They start lessening their adherence to their diet. They don't maintain those good habits that we know to be predictive of weight loss. And that promotes weight regain. And what happens physiologically is that these weight loss plateaus are essential to allow our bodies to be able to almost reset, and we can continue to lose weight after that.
So they have to break this set point? Is that what you're saying?
Right. So the set point theory, even though it's not universally understood, it's this body weight regulation that combines genetics, the environment, and physiological principles.
So it's kind of a thermostat that people or the body has to use as a reference when they go beyond it or below it when trying to lose weight. The body will try to push them up. So when they put a lot of stress on that, the resistance will become stronger. And this is where they hit a certain plateau after a while. Is that correct?
That's correct.
That leads us to our second obvious question, how can the clinical dietitians break the plateau within their scope of practice? So, and what type of foods should they shift to in order to overcome such a plateau? So we're looking here at the role of the dietitians.
Sure.
What's your insight?
So what we know is that even the most divergent diets are capable, at least to some degree, of achieving at least short-term success in weight loss. And even our longest weight loss studies that we have that target different macronutrients, like low carb versus low fat, at the end of the day, they have similar body weight trajectories. What we know to be more important is the dietary adherence rather than macronutrient composition. So a dietitian could really focus on helping a patient or client adopt those new eating behaviors that they can really adhere to for the rest of their lives and focus on that more so than the macronutrient composition.
So when you mentioned the behavior, are we looking here at a pattern or a habit for the clinician to break the plateau? Or is that like asking them for a certain habit in the diet they're doing?
Right. So helping them identify those good foods that a person can, eat on a daily basis and don't feel restricted. That's the best thing for a dietitian to do. And
our third question, some research indicates that weight loss plateau has a certain timeline of 8 to 12 weeks. I know you're into the research, so I would love to hear your intake on this one. And what happens in the interim and how come it ends after that period? So it's a multi-level question, but we can start with the first one, the timeline of 8 to 12 weeks. What's your intake on this one?
Sure. So what we're basically seeing during this period is metabolic adaptation. And Dr. Kevin Hall and his colleagues at the NIH have estimated that for every kilogram of lost weight, calorie expenditure decreases by about 20 to 30 kilocalories per day. And our appetite at the same time increases by about 100 kilocalories. So during this period of time, our body is readjusting and almost creating this new set point for us.
Okay.
Now, with the 8 to 12 weeks, that's tough to define. And I think there's a lot of variability in that.
From a clinical perspective, do you see that in clinic, like this timeline? Is it something similar or close to that?
I think usually we see that period of 8 to 12 weeks.
Okay. We go to our fourth question. People believe that when they stop losing weight, it means they need to do more sports to break the plateau and continue on weight loss path. What is your intake on that?
What we know from the research is that diet plays a really strong role in helping us lose weight, and physical activity or doing more sports, more exercise plays the biggest role in helping us maintain that weight loss.
It's a misconception that doing sports would help them lose weight. It's only to maintain, right?
I think that's where the research is kind of really pointing.
So we go to our fifth question. Stress plays a major role in obesity management, and some research shed light on stress factors in weight loss. How much does stress play a role in weight loss plateau, and how to manage that?
Sure. I think it plays a huge role. It can affect our eating behaviors, our sleep, and even some hormonal responses, primary hormone being cortisol. So being able to manage that through some stress reduction techniques, one of the biggest ones in research that we know is social support can really help a person overcome that weight loss plateau.
So what about sleep in weight loss? We're going to our sixth question. What about sleep in weight loss plateau? Since you mentioned stress reduction, some information shed light on the importance of sleep in weight loss plateau breaking. That's a bit weird, since sleep is more sedentary, not really helping the metabolism hype up. What's your intake on this one?
So very much similar to stress, sleep plays an important role in helping us basically take a break and recalibrate our bodies. And when we don't get that restorative sleep, we see increases in cortisol levels and inflammation, and that's counterproductive.
So one of the advice dietitians can give, like, get more sleep in order to break your weight loss plateau as it decreases the stress.
Right.
Our seventh question is intermittent fasting and popular diets are marked on social media and even in medical literature as a method to refer to for breaking the weight loss plateau. And definitely the patients come with the loads of social media on their agenda when they come to see their dietitians. How much of this is true? And which diet is evidence-based? And what is your clinical experience on that?
Sure. I also get a lot of patients that come in with a big interest in this diet, but unfortunately the research isn't there yet. There's a lot of different ways that we can define intermittent fasting and that people have tried to do it, but we don't have long enough studies to show that it's impactful. And the studies that we do show, by and large, it doesn't help versus other weight loss, traditional weight loss diets. So like with any diet, finding one that a person finds to not be restrictive and that they can do in the long term is the best option. And intermittent diets oftentimes are so restrictive that people can't follow them in the long term.
So our eighth question, after breaking the weight loss plateau, how can a patient continue in the weight loss journey? And what strategies should the dietitian follow, knowing that their patient has overcome that temporary halt in weight loss?
I think for clinicians, one of the biggest things is helping our patients and our clients understand that weight is not this just linear downhill. It goes up and down and it's zigzagged all along the way. So helping them understand the science of what's going to happen and that there's going to be ups and downs along the way, but as long as we're making a general trend in the right direction, that's going to be beneficial. And also helping them understand that these weight plateaus happen to just about everyone in the middle, but we can overcome them through successful strategies.
Brilliant. So when this plateau happens within, let's say, 6 months, it's more correlated with a psychological thing compared to a weight loss happening after a year of doing weight loss protocols. What do you think?
I think it really is psychological at that 6 months that people get frustrated when they're trying their best, but all of a sudden they hit this plateau. I'm doing the same thing. Shouldn't I be losing 10 pounds like I did the month before? Again, it's that our body's resetting. Once we get past that, then we can succeed with weight loss again.
It's not only about weight loss, because the weight loss plateau is it's kind of a framework or a frame that everybody gets stuck into. It's like, if I'm not doing any weight loss, that's no progress. And they tend to forget the other factors involved in a healthy individual when they are losing weight, which are the actual cholesterol, LDL, triglyceride, HbA1c, all these metabolic disorders parameters. So what's your intake? Are you more focused on weight loss, or you also combine the labs with it?
I also combine the labs with it. Again, looking at that whole picture of the person, that we can have, dietary changes or even non-food aspects of their lives, that we're getting more sleep, we're exercising more, all those beneficial behaviors. And just because you're not losing weight, you are feeling healthier about your body, and that's positive.
Lovely, lovely. Mathew, I'd like to thank you for being with us today. And I hope a lot of the aspects of weight loss plateau have been addressed for patients, and would love to see the comments of everybody under that video and see what's your input onto this topic. Thank you very much, Mathew, and see you later. Ciao, ciao.
Thank you.